Hello, my name is Nathan Long. I'm a paramedic student with Pierpont Community Technical College. Today I'm going to go over shockable cardiac arrest. When you first show up at a cardiac arrest, it can be intimidating to say the least, and I hope this presentation gives you an understanding of your role as a team leader and how to direct your team to be as efficient as possible. First, check pulse. Now this step is important, however you skip it, do not stop compressions to check for a pulse. If you start doing compressions on the patient that you should not be doing compressions on, they will certainly let you know. Next step will be to start chest compressions. If you're the team leader, direct someone to do it. You should be focused on the airway or the IV, especially if you're the only paramedic on the scene. Place pads and defibrillate. Defibrillate the patient every 2 minutes. Resume compressions to 2 breaths. Compressions every 2 minutes. After the 2 minutes of compressions, check rhythm. Check the rhythm. As a team leader or one of your teammates, depending on if there are more paramedics on the scene, you should have an IV access within 90 seconds of the code. As soon as IV access is placed, you should give your first dose of epinephrine. That's 1 milligram of 1 to 10,000 epinephrine. This is given every 3 to 5 minutes for the duration of the code. Resume compressions, and if 2 minutes have passed, then defibrillate and resume compressions, being sure to switch compressors every 2 minutes. And after your 2 minutes is up, do another rhythm check and a pulse check. At this point in the code, whoever's on the airway may want to consider intubation of the patient so we can give continuous breaths. So get your equipment, check it, perform the skill. Do not stop compressions to intubate. Once intubated, you can give continuous breaths. Just make sure you listen for proper tube placement. Make sure it's not main stemmed or in the esophagus. And then hook up capnography to guide your ventilations and also help you diagnose maybe the patient if he's acidotic. Defib after 2 minutes and resume compressions. Give epinephrine 1 milligram to 1 10,000 IV push. And then defib after 2 minutes. Be sure to check rhythm, change pulse each time. And then resume compression, switching off every 10 minutes. And at this point in the code, everything running smoothly, consider administration of amiodarone. It's not going to be 150 milligrams like in stable VTAC, but it's going to be a 300 milligram IV push, and it's not over 10 minutes. It's just IV push, followed by another dose of 150 milligram IV push. And if no rhythm change, start to consider reversible causes such as hypovolemia, hypoxia, hypothermia, tension pneumo, or cardiac tamponade, drug overdoses, or acidosis. Resume compressions and defib every 2 minutes, and epinephrine 3 to 5 for at least 20 minutes. And at this point, you should know how to successfully work cardiac arrest, shockable arrest. I want to go over some key points. As a team leader, it is your job to direct your team to their roles and keep things running smoothly. Whatever role you place your team member, make sure they're performing effectively and switching off when required. And this is Nathan, and I hope you now have the confidence to lead your team during your shockable cardiac arrest. Stay tuned, and we'll go over post-resuscitation care after you've achieved return of spontaneous circulation. Thank you. Have a nice day.